The 2026 Medicare You Handbook has arrived, and it's a dense 100-plus pages. But you can skip the reading because I've already done it for you. Today, I'm going to break down the most important updates in a way that's easy to follow. Inside are critical changes that will directly impact your wallet and your coverage. From a landmark new cap on prescription drug costs to sweeping changes in Medicare Advantage plans, let's focus on what these updates actually mean for you. So, what are the most critical updates for 2026? Let's start with the biggest headline: prescription drugs. For years, seniors have struggled with unpredictable and soaring medication costs. First is the new $2,100 annual cap on out-of-pocket drug costs. In 2026, that changes dramatically thanks to two landmark updates. This is a game changer. If you have a Medicare Part D plan, once your personal spending on covered prescriptions hits $2,100 for the year, you will pay $0 for all your other covered drugs for the rest of that year. This provides an unprecedented level of financial protection, especially for those with chronic conditions or expensive medications for things like cancer or rheumatoid arthritis. The second major update is the Medicare Prescription Payment Plan. Starting on January 1, 2026, Part D plans must offer you the option to spread your out-of-pocket cost throughout the year in the form of monthly payments. Instead of facing a huge bill of several $100s in January or February, you can elect to cap your monthly payment at a more manageable amount, likely around $175 per month. This program is designed to eliminate bill shock and make budgeting for medications far more predictable. Together, the spending cap and the payment plan represent a fundamental shift in how Medicare addresses drug affordability. But while this news brings relief on the prescription front, another story is unfolding that is causing significant disruption, and it concerns Medicare Advantage plans. As the handbook reminds us, these plans are managed by private insurance companies. While they must be approved by Medicare, these companies can and do change their benefits, provider networks, and service areas each year based on profitability and strategy. For 2026, we are seeing this happen on a massive scale. Major national insurers like United Healthcare, Humana, and Aetna are significantly reducing their footprint, pulling their plans out of dozens of counties across the country. United Healthcare is exiting 109 counties alone, and when you factor in all the carriers, nearly 2 million Americans currently on Medicare Advantage plans will find their plan is no longer available in 2026. If you are one of these individuals, you will receive a non-renewal notice from your insurance company. Do not throw this letter away. It is incredibly important because it grants you a guaranteed issue, right? This right is your golden ticket, your path to stable, predictable coverage through what's known as Medigap, or Medicare Supplement Insurance. With this right, you can switch to a Medigap plan without any medical questions and cannot be denied coverage based on your health history. Medigap plans work with Original Medicare and are standardized by the federal government, identified by letters. The benefits of a specific plan letter are the same no matter which company you buy it from. Plan G is the most popular choice for new Medicare beneficiaries as it covers virtually all of your out-of-pocket costs, except for the annual Part B deductible. Plan N is a great lower-cost alternative that requires small copays for doctor visits, while Plan F is the most comprehensive plan, but is only available to those eligible for Medicare before 2020. Your guaranteed issue right ensures you can enroll in one of these plans, which is a huge relief for anyone with pre-existing conditions. Now, let's circle back to the other half of the prescription drug story: the plans themselves. The Part D market has shrunk dramatically. Where there were once dozens of companies competing, we are now down to a handful of major players. This consolidation means fewer plans to choose from, which can simplify the selection process. However, less competition often leads to higher prices. For 2026, many Part D premiums are increasing significantly, with some rising by $40 or more per month. The standard Part D deductible is also rising, from $590 in 2025 to $615 in 2026. This is why experts always advise you to marry your Medigap but date your drug plan. You should reshop your Part D plan every single year during open enrollment to ensure you're not overpaying. To successfully navigate these changes and take advantage of periods like open enrollment, you need to know the official timeline. On October 1st, you can begin previewing the new 2026 plans. The annual enrollment period runs from October 15th through December 7th. This is your main window to make changes. Your new coverage then begins on January 1st. Finally, from January 1st through March 31st, there is one more window for those in an Advantage plan to make a change. Finally, the handbook ends with a crucial warning about something that becomes especially important during these enrollment periods: fraud. As you review your options, you must be vigilant. Scammers are highly active, and you should remember that Medicare will never call you to sell you a plan. Be suspicious of anyone asking for your Medicare number or banking information over the phone. You can protect yourself by creating an account at medicare.gov to track your claims and by regularly reviewing your Medicare summary notices. If a deal sounds too good to be true, it always is. So let's quickly recap the essential takeaways from the 2026 Handbook: a new $2,100 cap on drug spending, a payment plan to smooth out costs, major Medicare Advantage plan withdrawals, creating guaranteed issue rights to switch to Medigap, and rising Part D premiums that make shopping around more important than ever. Remembering these points will put you ahead of the curve. The big question this year is how these changes will balance out. Will the new drug savings outweigh the disruption from Advantage plan cuts? It's a critical trade-off and one that puts the power of choice back in your hands this enrollment season. I hope this breakdown of the 2026 Medicare Handbook was helpful. To get more simple, straightforward updates that can save you time and money, please like this video and subscribe to the channel. And if you have any questions about these changes, ask them in the comments below. I'll do my best to answer.